hand. The DA says the investigation at Tembisa Hospital should extend to other public health facilities in Gauteng. The Hawks have conducted a search and seizure operation following an investigation by the SIU earlier this week. They're currently looking into irregular contracts worth more than 500 million rand. For more on this, we're joined by the DA's Refiloe Ntsekhe. Very good afternoon to you. Thank you so much for your time. You're saying that it needs to go beyond just one hospital, and Gauteng in itself, in terms of hospitals, need to be scrutinized.
Correct. Let me start by greeting your viewers at home, and thank you for having me on. I mean, when we look at what Babita was trying to uncover, it's far more than just Tembisa Hospital. And yes, while we appreciate that there's possibly an SIU investigation that will be, the report will be coming out soon, it's not only Tembisa Hospital. There's far more happening in our hospitals than we see. And so we want that investigation expanded to all our hospitals in the province.
You saying that you suspect that it could be a lot more extensive in terms of what we could uncover when it comes to the corruption that's at hand?
Correct. Because if you look at Tembisa Hospital, I mean, the fact that we've got people sleeping on the floor, I think you saw the video that went viral from the day before, including yesterday. And then you hear there's possibly over 800 million in corruption that took place at that hospital, denying people access to proper health care in terms of resources, whether it's medication, beds to sleep on, etc. Then you realize that actually some of the other hospitals are in the same problem. I mean, there's so much that Jack Bloom has actually uncovered in terms of challenges where money is being taken into the wrong places instead of going into needed resources and medical resources to assist the health professionals to be able to carry out their duties in these hospitals.
What do you think in terms of steps need to be taken when it comes to the implicated companies?
First of all, I think the people who own these companies must be arrested, including the people who gave them these tenders. I mean, Tembisa alone, you know, it was one person with multiple companies. He should be arrested, and the person who gave him the tenders should also be arrested once the full investigation is concluded. In addition to that, I believe these companies need to be blacklisted, because blacklisting that company from Tembisa Hospital doesn't mean we're not going to see it somewhere else in government. And I'm not talking only in hospitals. It could easily be in a municipality somewhere or in another department of the province. So if they are blacklisted from the national database, then they'll never be able to do business with government until they understand that until you're clean, you will not do business with government. And we only want to work with people who are honest and have integrity and want to serve South Africans.
So as you make these calls, we know that the SIU has applied for a presidential proclamation to extend its probe beyond Tembisa, its probe of Tembisa Hospital contracts. What steps are you taking to make this call and ensure that the probe is far wider and escalated across Gauteng hospitals?
Obviously, in our work in the legislature, we've been appealing to the Premier to actually extend this probe to beyond just Tembisa Hospital. I would even say beyond just health into other departments. I mean, I'm the Shadow MEC for Social Development, and there's some funny-looking stuff. I mean, the Auditor General already fingered irregularities in the department that I oversight. So it's not just health. We think the whole Gauteng should actually go through a whole probe to make sure that money is going where it's supposed to be going.
Yeah, and we've seen the impact of money going where it's not supposed to be going, especially as you make mention and reference to the video that's circulating about the dire circumstances within the hospitals and how patients are in the end affected.
Correct. I mean, one can even ask, I mean, what was the hospital doing with skinny jeans? I mean, that for me is, it sounds like a joke, but when you work with people in Tembisa on a daily basis and you see this hospital is called the Hospital of Death, a hospital is supposed to be a place where people go for healing. Yes, from time to time there might be a death, but this cannot be the standard.
Yeah, Absolutely. Thank you so much. Let's perhaps leave it there for now. Thank you for your time. DAMPL, Refiloe Ntsekhe, saying that the probe, when it comes to the Tembisa Hospital, that's only just the beginning. It should be even wider in terms of uncovering what is happening when it comes to the finances of hospitals across the province.